In the neonatal ward in Freetown, Sierra Leone, 3-week-old baby Zaria is starting her third day on life support, receiving treatment for bladder and bowel malfunction. She was rushed to the hospital after her mother Kamara noticed her poor health about a week after she was born. But unfortunately, the neonatal ward, one of the busiest wards in the hospital, is overwhelmed because of the lack of medical staff and inadequate equipment and supplies. The ward is full of sick patients sharing beds, and additionally, the equipment needed for treatment, including proper life support machines, is only available in district and regional hospitals. Under these circumstances, Zaria continues to lose weight, and after 1 week in the hospital, baby Zaria dies due to complications arising from a treatable infection. Unfortunately, with proper medical care and technology, Zaria's death could have been prevented. In Sierra Leone, one of the world's poorest countries, with some of the most meager health standards, cases like Zaria's are far too common. In fact, for every 1,000 babies born in Sierra Leone, 89 die within weeks of birth. Compared to the U.S., where less than 6 out of every 1,000 babies born perish in their first few weeks. Poverty is rampant. This is a country where over 60% of the population lives on less than $1.25 a day. With the sanitation and hygiene standards common in most parts of Sierra Leone, the spread of infection and diseases is inevitable. Some health facilities don't even have toilets. While this poverty does play an enormous role in the alarming infant mortality rate, limited access to quality health services, including the lack of trained staff and the use of old, outdated equipment in hospital neonatal wards, remains a huge obstacle to solving Sierra Leone's crisis of infant mortality.
Hi, my name is Carmina, this is James, and this is Hamza, and we're the team behind the Joey Baby Warmer. Today we're going to talk to you about high infant mortality rates in Sierra Leone and how the Joey Baby Warmer can do to combat that.
Hi, I'm Hamza. I'm the Chief of Industrial Design and Engineering. I am responsible for overseeing all design and innovation aspects of our company's products and services, including product design, user experience, package design, and etc. I am also responsible for aspects of advertising and marketing. We are here to talk about the Joey Baby Warmer and how we are going to push limits of neonatal machinery.
I'm the Director of Strategic Partnerships for the Joey Baby Warmer. My role within our organization is to drive client leadership and foster strong relationships. I'm essentially here to help drive revenue-producing initiatives, and essentially I'm here to serve as your trusted advisor when it comes to the Joey Baby Warmer.
I'm James Brosnan, and I'm the head of operations and logistics. My main purpose is to monitor production of these baby warmers, as well as ensuring that the right number of warmers get precisely from point A to point B. I work closely with our sales and marketing teams, as well as our foreign partners, to address any obstacles that arise during the distribution of the warmer.
According to the World Health Organization, Sierra Leone's infant mortality rate is 89 per thousand births on account of the country's insufficient healthcare infrastructure and defective medical technology.
To address these specific issues, we've developed the Joey Baby Warmer, which is a newborn conductive warmer designed specifically to allow rural hospitals with limited resources and inexperienced staff to successfully treat premature and low birth weight newborns who are specifically vulnerable to hypothermia and other various infections.
The Joey Baby Warmer is an inexpensive polycarbonate tub-shaped basin, which is a medical device designed for use in developing countries for the purpose of preventing infant mortality by nurturing newborn children in a protective and warm environment, which they can grow stronger in. Our product works simply by plugging the plug into an outlet. From there, the user can set the temperature of the Joey by turning the knob either to the left or the right.
So now we're going to talk about the unique benefits of the Joey Baby Warmer. First of all, it's hard to use wrong. You simply plug the user interface and it automatically sets a safe and effective surface temperature. The bassinet itself only fits a single term newborn in order to reduce the incidence of cross-infection from newborns sharing beds. It's also very easy to clean. A modern incubator can take up to 45 minutes to clean properly, given all of the internal seams and crevices, whereas the Joey Baby Warmer has a smooth, seamless interior that can be wiped clean with alcohol in just minutes. The Joey Baby Warmer also maintains the temperature of newborns who cannot be thermoregulated using skin-to-skin contact because they are in the neonatal intensive care unit. Additionally, the Joey Baby Warmer is robust. The power supply will be specified for 100 to 240 volts or 43 to 67 hertz to better manage the variations in low-quality mains electricity in low-resource settings. The housing will also be sealed from dust, and the Joey Baby Warmer will contain no moving parts. The bassinet will be made from high-strength polycarbonate as well.
So as I stated before, Sierra Leone has one of the highest infant mortality rates in the world, due largely to common illnesses and conditions such as acute respiratory infections, prematurity, pneumonia, sepsis, and birth asphyxia. Now supported by UNICEF, the World Health Organization, and the United Nations Population Fund, Sierra Leone's Ministry of Health and Sanitation has made improving maternal, newborn, and child health a key concern going forward. They've initiated a Saving Lives program which will work relentlessly to improve the health system and reduce maternal and infant deaths across the country. This Saving Lives program is committed to reducing neonatal mortality to only 12 per 1,000 births by 2030, a huge leap from the 89 per 1,000 births rate that's currently in Sierra Leone. The Saving Lives program also aims to ensure that by 2021, 62% of newborns receive a first postnatal care checkup in the first 48 hours after delivery. With its cost effectiveness and durability, we believe the Joey Baby Warmer can become one of Sierra Leone's top infant care products, especially through a close collaboration with UNICEF, the World Health Organization, and Sierra Leone's Ministry of Health and Sanitation. So Humps and I wanted to discuss a few alternatives to the Joey Baby Warmer and really demonstrate why the Joey Warmer is the best product for the Sierra Leone medical industry in keeping babies warm. Now the most ideal method for keeping a child warm would be through skin-to-skin contact with the mother. That's ideal for preventing hypothermia, but it's not always possible. Vulnerable newborns need another form of active warming if their mother is infectious, or if they need other treatments like phototherapy, or even during brief stays away from their mother in the emergency room or in a neonatal unit. So the most common alternative to skin-to-skin contact is an incubator, which is a convective warming device that provides warm and humid air that is regulated by measuring the newborn's skin temperature with the disposable stick-on probe. The other alternative is a radiant warmer, which provides heat through infrared radiation that is also regulated by skin temperature probe measurements. Now unfortunately, neither the incubator or the radiant warmer is well suited to the context of a low-resource hospital. Both are very complex, very expensive to maintain, and difficult to keep clean. So newborns now are particularly vulnerable to hospital-acquired infections. It takes 45 minutes to properly sterilize an incubator between patients. Few rural hospitals in developing countries have the resources to follow this protocol. In addition, few can afford to maintain a sufficient number of incubators, so it's not uncommon to find 2 or more newborns sharing a single device, thus contributing to the spread of infection. Whereas the Joey Warmer can only fit 1 infant at a time. Now finally, devices like incubators and radiant warmers are designed with American or European hospitals in mind. In a low resource setting, spare parts are hard to source, power spikes and outages are common, and humidity, dust, and bugs are tough on all electronic equipment. Up to 98% of medical equipment donated to the developing world from wealthier countries is broken within 5 years, but the Joey Baby Warmer has been proven durable.
In addition to incubators and radiant warmers, there are other conductive warmers on the market. For example, Embrace and CanMed. But neither device is compatible with double-sided phototherapy, and both are extremely expensive for low-resource settings. Both devices use fabric covers that will be difficult to keep clean, or disposable liners that will be difficult to source.
We plan to sell our product directly to hospital neonatal divisions. We're going to start by targeting hospitals in the most densely populated areas that have the largest annual number of live births. This because the percentage of facility-based births are much higher in urban settings. We're also going to work closely with UNICEF and the Ministry of Health and Sanitation to establish relationships with hospitals and help these organizations to meet their own goals in Sierra Leone. Once the hospitals have our product, they will become key advertisers and promote our product to local clinics and agencies once the Joey is a success. And after hospitals have agreed to purchase our warmers, they will be shipped out from the manufacturer directly to a distributor, such as Freight Care, to transport the warmers directly to hospitals.
Hi, I'm Dr. Ravi Patel, and I've been working with the Ola Daring Children's Hospital in Freetown, Sierra Leone for the past 5 years. Through the implementation of the Joey Baby Warmer, we have seen a 20% reduction in infant mortalities in each of the past 6 months. Not only is the Joey Baby Warmer easy to use and cost effective, but it's also essential for infants' growth and a healthy future.
Too often, Sierra Leone's hospital neonatal wards are ill-equipped to deal with the influx of ailing infants, and too long have the families of this rich cultured nation pay the ultimate price. It's time to reverse this trend with the introduction of the Joey Baby Warmer. The Joey Baby Warmer is unlike any other infant warming device, with its unique and effective design and ease of application. This warmer was specifically targeted to assist low-resource hospitals in keeping the future leaders, scholars, and athletes of Sierra Leone safe, warm, and protected.